Hello friends on Facebook and YouTube Live. Welcome to another episode of Get Healthy with Dr. Cooper. We have been having a wonderful time over the last several weeks. Last week we looked at diabetes. The week before that we looked at testicular cancer. We also look at prostate cancer and breast cancer. Well, this week, get out your pens and your paper and remember to like our page and share the information. This week, the topic is pancreatic cancer. Now, pancreatic cancer is a cancer that no one wants to have. It is one of the few cancers in which there are not much improvement in terms of survival rate over the years. According to research, 93% of patients with pancreatic cancer will die within 5 years, and 71% will die in the first year. Pancreatic cancer usually is diagnosed at an advanced stage because the symptoms are usually very vague. It is believed that 1 in 65 men or women will develop pancreatic cancer over life. And that in the United States, this year, 50,000 new cases will be diagnosed. And of course, worldwide, 330,000 cases will be diagnosed. It is one of the most prevalent cancers. And it is believed that in terms of all the cancer, it shares 10th place with kidney cancer worldwide. And as I mentioned before, 338,000 new cases of pancreatic cancer will be diagnosed globally, yearly. And in the United States, it is believed that pancreatic cancer 43,000 to 50,000 patients will be diagnosed with pancreatic cancer. Now, we have spoken about pancreas. I mean, if you've listened to this show before, you must have heard the word pancreas. Now, what is the pancreas? Where is it? And what is the function? Before we continue to discuss pancreatic cancer, we need to look at the anatomy of the pancreas. Where is the pancreas? So this time I'm going to put on the screen the pancreas. So let's put the organ there, the pancreas. Now, there you can see a healthy pancreas and a cancerous pancreas. Now you see that the pancreas, it's an elongated shaped organ or gland. It has different parts. It has the head that is at the junction between the stomach and the small intestines. And then it has a neck, a body, and a tail. The pancreas is located right behind the stomach in the upper abdomen. It plays a very essential role in converting food that we eat in the fluid that the body needs. The pancreas has two main functions: an exocrine function that helps in digestion and an endocrine function that regulates blood glucose. And as I mentioned, the pancreas is located behind the stomach in the upper left abdomen. It is surrounded by other organs, including the small intestine, the liver, and the spleen. It is about 6 to 10 inches long, and its shape is flat like a fish or a tadpole extending across the abdomen. Now let me show you exactly where the pancreas is. Let us change the slide to the other slide showing exactly where the pancreas is. There we go. So if you see there the abdomen, that red organ is called the pancreas. And you see it's shaped like a fish, it's shaped like a tadpole. The head is towards the right, and it's wrapped around by the small intestine, the duodenum, and then we have the body and the neck, and then we have the tail. Now, if the cancer is developed in the tail of the body, then the symptoms might be slow, nonspecific. If the cancer is in the head of the pancreas, then we'll have probably obstructive symptoms. Patient will have jaundice, more pain, and maybe earlier diagnosis. Now, as I mentioned before, the head of the pancreas is at the junction where the stomach meets the first part of the small intestines. And in the head of the pancreas, we have most of the exocrine function, where the pancreas secretes digestive enzyme, lipase to digest fat, amylase to digest carbohydrate, trypsin and chymotrypsin to digest protein. And then, of course, we have the endocrine function, where the beta cells will secrete insulin. We also have glucagon for blood sugar regulation. Now, disease of the pancreas can be pancreatitis. Now, let's see if we have a diagram showing pancreatitis. Do we have a diagram showing the pancreatitis? Let's put that picture up so we can, there we go. Now, as I mentioned before, one of the function of the pancreas is an exocrine function, where the pancreas secrete enzyme. These are chemicals that we need to digest our food. So when you ingest food, the digestive system starts in the mouth, the process and gets down into the stomach, then in the small intestines. The pancreas will secrete enzyme in the small intestine, which will help to break up the food that we consume into nutrients that we absorb. Now, in the pancreas, we have ducts. If the ducts are blocked because of, stones or anything like that, then there will be a backflow of these chemicals, and that will cause inflammation of the pancreas. Patient will develop severe pain, vomiting, may have fever, high blood sugar, high white count. Patient will need to be in the hospital to be treated with antibiotic, IV fluid, and rest in the pancreas. That is not cancer, but inflammation of the pancreas. Some of the factors that can cause pancreatitis, one is alcohol. Recurrent use of alcohol can give, recurrent pancreatitis. Patient will have possibly calcification of the pancreas on X-ray. Other things are infection, and drugs can cause pancreatitis. Now, if the patient doesn't have pancreatitis, then the patient can have pancreatic cancer. Now, what are some of the risk factors for pancreatic cancer? Let's go over the risk factors. Now, one is age. And as I mentioned before, that as one gets older, there is a decrease in the immune system. Patient is more likely to get various type of diseases, and one of them is cancer, any form of cancer. So the older you become, age 50 and above, there is an increased risk for various type of diseases, and one is pancreatic cancer. Obesity. Obesity is a risk factor for cancer, pancreatic cancer, one of them. Now, if you have been watching the show, you will hear that I mentioned that obese patients tend to have high insulin level. Insulin will produce an insulin-like growth factor, which will cause growth of tumor growth, and tumor growth such as benign tumor or cancerous tumor. It is also believed that having diabetes, could be a risk factor for pancreatic cancer. The link is not quite clear whether diabetes will precedes the cancer or cancer will cause the diabetes. But there's a link between sudden onset of diabetes, sudden weight loss, and pancreatic cancer. Now, the other factor is dietary factors. We all know that an intake of saturated fats will increase the risk for cancer. And as you continue to listen to the program, you will realize that I will emphasize the need to eat healthier. Processed meat will increase the risk for various cancers like pancreatic cancer. Red meat, a diet high in saturated fat, will also increase the risk for various cancers, including pancreatic cancer. Now, a diet that is high in vegetables and fruits will decrease the risk for cancer, including pancreatic cancer. A diet high in fruits and vegetables will increase the immune function and therefore will decrease the risk for cancer. And many studies have shown that a patient who emphasize plant-based nutrition, the blood of that patient will slow the growth of cancer. Now, the other risk factor is smoking. Many research show that 20 to 30% of pancreatic cancer are linked to tobacco smoking. And it will take about 20 years after stopping smoking for the risk to decrease to a non-smoker's level. And what about alcohol? Alcohol is a risk factor for many diseases, breast cancer, pancreatic cancer. It is believed that if someone consumes 3 or more drinks per day, that person will increase his risk for pancreatic cancer by 6-fold. Alcohol can also lead to pancreatitis, and pancreatitis could be a precursor, a recurrent or chronic pancreatitis to cancer. Now, what is a drink, you may ask? A drink is 8 ounces of beer, 5 ounces of wine, and 1.5 ounces of hard liquor. That is a drink. So if you're consuming over 3 to 4 drinks a day, then you're going to increase your risk 6-fold for getting pancreatic cancer. Now, another risk factor is chemical exposure. So if you're exposed to pesticides, if you're exposed to other chemicals like metal refining, if you're working in metal refinery, then you're increasing your risk for pancreatic cancer. Petroleum. Exposure to petroleum components and solvent will increase the risk for pancreatic cancer. Some dyes and polycyclic aromatic hydrocarbons are precancerous. Now, as I continue, you're going to hear me discuss again about polycyclic aromatic hydrocarbon and barbecue meats. So don't go away, stay right there. Another risk factor is genetics. We all know that our genetics will place us at a higher risk for certain diseases, including cancer. But if we live a healthy lifestyle, we can actually retard our risk for getting these cancers. So it is believed that patients who have the BRCA2 gene are at a higher risk for pancreatic cancer. Patients who have familial melanoma gene, also familial pancreatitis, PRSS1, will have increased risk for pancreatic cancer. And what about inactivity? Inactivity, sedentary lifestyle, will increase one's risk for developing many diseases. One of those would be pancreatic cancer. It is believed that exercise increases immunity. Immunity then will protect you from getting diseases such as cancer. So if you want to stay healthy, then these are some of the things you need to follow. Eat a healthier diet, decrease red meat, avoid processed meat, exercise, and you will increase your chance of retarding some of these diseases such as pancreatic cancer. Now, as I mentioned before, that pancreatic cancer has a high mortality rate, 93% within 5 years. But there are some patients who are lucky enough to have their cancer diagnosed early. These patients have a better chance of survival. And I have a patient who is 16 years post-pancreatic cancer. And I'm going to have you listen to her story at this time. Today our focus is on pancreatic cancer. And as I mentioned, this cancer affects over 330,000 people worldwide, and in the United States, over 40 to 50,000 people are diagnosed yearly with cancer. But what is so specific about this cancer? This cancer is one of the worst cancers in that mortality rate is about 93% in 5 years. Only a few patients survive. The reason for this is that we have no clear diagnosis, and also patients present with symptoms that are not specific. However, there are a few patients that really survive. But on my show today, I have a miracle patient, Mrs. Miriam Carnes. Welcome to Get Healthy.
Thank you, Doctor.
So, Mrs. Carnes, you look as healthy as anybody else.
Yes, and I feel
You feel
blessed.
healthy. You're
Yes,
blessed.
I feel healthy.
You're totally blessed. Now, tell me, were you diagnosed with pancreatic cancer?
I wasn't. At the time, my husband and I were still winter Texans, and we were going back and forth. And I had had testing up north, but the doctors never, they ordered all kinds of tests, but they didn't ever put hands on. And I had pain in my liver. It was hard and painful for 4 days. On the 4th day, I came to see you, and I can remember you putting hands on right across 2 or 3 times, and right away I was going for an ultrasound.
That's right. So ultrasound, so you presented with abdominal pain, which was on and off for a while.
Right.
Yes, and what else? What other symptoms did you have?
Just diarrhea.
Exactly. I think that was your predominant symptom.
Right.
You kept having this diarrhea for a while, and we just couldn't, put a diagnosis on. And then I thought that probably it was your pancreas. I thought you had chronic pancreatitis. And we did the scan, sonogram, CT scan, and we diagnosed your cancer.
Right.
And how were you treated?
Well, I was referred to a famous hospital who called me on the phone and said our doctor's time would be better spent with someone we could help. And I think I called you, and I was a basket case. And I remember saying, what am I supposed to do, just sit in the corner and die and not get a chance to fight? And you said, calm down, Mrs. Carnes. I will take care of you. And you did. You sent me to San Antonio to the research center there, and I had my surgery at University Hospital there.
Very good, very good. You're one of the few. So you had part of your pancreas removed. Most of the pancreas was removed.
80%.
And you were 80%.
80%.
Right, and you were left with possibly the head part of the pancreas.
Right.
And then you developed, diabetes as a result of that. Right. Now, how long ago was that, Mrs. Carnes?
Well, it was 16 years on the 16th of November.
Imagine that.
Yes.
The 16th of November, 16 years.
Exactly.
As I mentioned before, you are one of the few patients who have survived so long. And you're totally cancer-free. You have cancer nowhere, right?
Right. My tests show nothing.
Exactly.
Yes.
So the key to this was early detection.
Exactly.
Because I remember that your cancer was encapsulated.
Right.
It was still within the pancreas. So removing the pancreas, you were not treated with chemotherapy. You had no radiation, am I right?
Right. I had a tumor, and inside the tumor was 3 cancers, but they hadn't metastasized. So.
That's right. And now you are doing well.
Yes, thanks to you.
Oh, well, thanks to God, you know.
Yes, definitely. I believe in the power of prayer.
That's right. I think you had an angel. And also early detection. You know, if you're listening to Mrs. Karn's story, and if you have pain, abdominal pain that might go to your back, if you have diarrhea that, you know, has been there for a while, if you're just not feeling well, then you need to see your doctor. Because as we mentioned, pancreatic cancer has a very high mortality rate. 93% of patients who are diagnosed with pancreatic cancer will die within 5 years. As a matter of fact, the cancer usually is diagnosed in an advanced stage. So most patients will die within 6 months. So therefore, healthcare providers need to have a high suspicion of cancer and start making the diagnosis. In Mrs. Karn's case, her diagnosis was made pretty early. She had classic symptoms: pain that was lingering on, diarrhea that was not controlled with any treatment, and then of course the diagnosis was made. And she has been blessed. She is lucky. She's one of the few patients that have survived for so many years, and she's totally cancer-free. Mrs. Carnes, what did you tell our viewers about your case? How do you advise them to seek medical attention? What do you have to tell them?
Well, like you said, if you feel like something's wrong, go to the doctor. If you find out there's nothing wrong, that's good. You know, just go to the doctor and early, as soon as you think something's wrong.
And if the doctor is not proactive and keep telling you, well, I don't think anything is wrong, then you should insist that the doctor do something. Or you might want to get a second opinion. Am I not right, Mrs.
Oh,
Martin?
yeah, I think a second opinion is
That's
good.
right.
Except I had you, so I'm
So as you mentioned, you were winter Texan and you had your symptoms up north.
Right.
But the doctors did not make your diagnosis.
No, they just ordered tests.
Right.
And they never put hands on. Never.
They did not examine you.
Right.
Right. So, and then you came down to the valley, and then you really got blessed because your diagnosis was made right then and there, and you were sent to the appropriate tertiary institution because it is a complicated surgery to remove part of the pancreas. But you got most of the pancreas removed, 80%, and then you're left with 20%. You're doing very well. Your only problem right now is only the diabetes, right?
Diabetes, yes. And my insulin pump, and I've learned to eat, by going to your wellness center, I learned to eat better and lost weight. And I try to keep my A1C between 5.1 and 5.6.
Very good.
And
I like
it
your
works.
mentioning lifestyle changes.
Yes.
Because as you continue with us in the program, I will discuss at the end of it how you can prevent pancreatic cancer. You know, early detection is good, but prevention is the gold standard. Mrs. Carnes came to the wellness center, Cooper Wellness Center here in South Texas, and she learned how to use plant-based nutrition to be healthier. I will discuss plant-based nutrition at the end of the program, so don't go away. You stay right there. We're going to be right back. Mrs. Carnes, you're totally blessed, and I thank you for being on the program.
And thank you.
And I hope that your story changed somebody's life. Don't go away. We'll be right back. Thank you so much for coming, Mrs. Carnes.
Okay, thank you.
So there you see a very positive outcome. Her cancer was diagnosed early. Consequently, she got appropriately treated, and she is 16 years post pancreatic cancer. If you're listening to me, please share this video. Also like our page. The intent of this program is to empower you through education so you can take charge of your health and change your healthcare destiny. You know, I'm a practicing physician here in South Texas. I'm an internist, board certified. However, I do practice traditional medicine, and I practice lifestyle medicine. I think in order to have these health miracles, patients need to know how to live, what to eat, what to avoid, and how to change lifestyle in order to positively influence their health outcome. We are discussing pancreatic cancer, a cancer that no one likes to have. Prognosis is very poor. Usually the cancer is diagnosed at an advanced stage. Patient usually lives 6 months to a year after the diagnosis. As I say, survival rate for 5 years is death rate is 93% of the patients who are diagnosed with pancreatic cancer will die within 5 years, and 71% will die within 1 year. What are the symptoms? There are really no specific symptom for pancreatic cancer. Patient might present with a constant abdominal pain, a pain that radiates from below the stomach to the back, and the pain is just consistently there. Pain might get worse when the patient after eating, or when the patient sits up or even lay down. The pain is constant. The pain sometimes is mild, moderate, or severe. Patient might have weight loss because the pancreas is important in digestion. The pancreas will secrete enzyme to help digest the food, for the food that you eat to get transferred into the bloodstream, the nutrients in the bloodstream. So if the patient is not getting these nutrients and this nourishment, the patient might lose weight. The other symptom could be jaundice, yellow pigmentation of the eye, the skin. The urine might become very dark. The stool might become white because the cancer will probably block the flow of the bile. The bile is produced in the liver, gets secreted in the intestine. But if the cancer is at the location of the head of the pancreas, and then there's a blockage in the flow of the bile, then this yellow pigmentation will get in the blood and get into the urine. So the patient might be jaundiced. The patient might feel ill, but the symptoms are so inspecific. And that's one of the reasons why the cancer usually is diagnosed when the cancer has metastasized. Now, how do you diagnose pancreatic cancer? Well, first of all, if you have any of the symptoms that I mentioned, chronic lingering pain, back pain or abdominal pain, worsens after ingestion of meals, if you have jaundice, like yellow pigmentation of your eyes, dark urine, light stool, or weight loss, or even sudden onset of diabetes with weight loss, then you need to see your doctor. See your healthcare provider for them to make a diagnosis of what is the reason for all of these symptoms. There is really no blood test to be done, no cancer marker for pancreatic cancer in the blood. So there is no specific blood test that your doctor will order. The doctor can order a sonogram to assess the pancreas, the gallbladder, and the liver. The doctor might also ask for a CT scan of the abdomen to diagnose or to investigate if there's a mass. The doctor might order MRI or ERCP, endoscopic retrograde cholangiopancreatograph, the long name. And then, of course, a biopsy. So these are ways in which the doctor will try to investigate the reason for the abdominal pain, the reason for the jaundice, the reason for the weight loss, or the reason for the sudden onset of diabetes. All right. Now, how can you prevent pancreatic cancer? You know, this program, the focus is not on treatment. Okay, pancreatic cancer is treated mostly with surgically, chemotherapy, and so forth. But my intent is not to discuss how to treat pancreatic cancer, but how to prevent pancreatic cancer with lifestyle modification. So these are things that we can consider. An active lifestyle. We all know that sedentary lifestyle will increase one's risk for many diseases, including pancreatic cancer. As I mentioned earlier on, exercise will improve the strength of the immune system and therefore will help you retard the development of cancer. Obtaining a healthier weight. Obesity is a risk factor for pancreatic cancer. So if you're overweight, then you should seek help in trying to lower your weight and getting to a healthier weight. Smoking. Smoking is a risk factor for many diseases. Various cancers, lung cancer, bladder cancer, pancreatic cancer. So quit smoking will decrease your risk for pancreatic cancer. However, as I mentioned earlier on, 20 years after you have stopped smoking, you will now decrease your risk to a non-smoker's level. Alcohol. Alcohol is a risk factor for cancer, like pancreatic cancer. Avoiding or decreasing the consumption of alcohol will therefore help you prevent or lower your risk of getting pancreatic cancer. What about avoiding harmful chemical exposure, fertilizer, petroleum? These are risk factors for cancer. And most importantly, changing your diet. Now, we all know that food is a #1 risk factor for many diseases: diabetes, heart disease, colon cancer, and pancreatic cancer. Processed meats such as ham, sausage, bacon, all these will increase your risk for cancer, many cancers, including pancreatic cancer. The World Health Organization has classified processed meat as a class 1 carcinogen. So if I were you, I would make sure that I do not touch anything called processed meat. And of course, red meat. Red meat has a high content of saturated fat. Saturated fat is believed to place you at risk for many cancers, including pancreatic cancer. Polycyclic aromatic hydrocarbon and heterocyclic amines. These are produced when meat is grilled or fried. These are carcinogens that you need to avoid in order to decrease your risk for pancreatic cancer. Now, you should also avoid excess calories that you might find in fats and protein. Excess calorie will increase your risk for obesity. And of course, obesity, as I mentioned earlier on, will increase your risk for many different cancers. What about smoked meats and salted meat? These are also food that you need to avoid because of preservatives such as sodium nitrite that are used in curing meat. These will lead to carcinogenic nitrous amine, which will place you at risk for getting many cancers. So then what should you eat? What should you eat? Before I answer that question, let me show you a cooking video. A video in which you will learn how to use plant-based nutrition to produce protein. Nuts and grains can substitute the intake of meat. So let's go to our cooking video at this time. Well, we're back in the kitchen, Maribel.
Yes, doctor, thank you for inviting me.
And today we've been discussing processed meat and red meat, the danger to health. So we have a substitute here. Maribel, what are you preparing?
That is correct. We're going to have an oat nut burger, doctor.
Very
all
good.
from scratch.
Good.
We're going to go ahead and start off by getting 3 cups of water. Bring it to a boil. We're gonna add all our ingredients except our oats, okay? We're gonna start off with our garlic, our yeast flakes,
Very good. Rich in vitamin B12.
the McKay seasoning,
Uh-huh.
the amino brags,
Amino brags, some basic amino acids.
our chopped walnuts.
Good for the protein and fiber, right?
That is correct. And we're gonna end up putting here our onion flakes too.
And some
And
of-
last but not least, our Italian, 1 teaspoon of Italian seasoning. You wanna crumble it with your fingers just to get that flavor to get going.
Very good.
Once you mix all of this in there, you're going to turn off the heat and add your 2 cups of oats.
Excellent.
You're gonna leave it covered. You can move it a little bit just to make sure that all the spices are going to be combined in one. And remove from the heat and leave it sitting for about 10 to 15 minutes.
Very good. And now, if you're wondering where are the proteins are found in the oatmeal. 1 cup of oatmeal will give you 5 grams of protein. There's also protein in the walnuts. Go ahead,
That
Maribel.
is correct. Afterwards, you're going to have more or less of a blend looking this way. Make your balls as big as your buns are. And all you have to do is cook them or bake them in the oven, for 20 minutes.
There we go.
Make sure you flip them after 10 minutes and then cook the other side and the size of your bun. And let me show you what they're gonna look like when you bring them out of the oven,
Excellent.
just like a hamburger patty.
And these are very delicious. I've tried them before. They're
That is
wonderful.
correct, doctor. You won't be missing out on any flavor.
Good. So how do we eat them? We could eat them on a burger patty. And you can put all the spices you desire. We could also use our
Flatbread.
flatbread. And for me as well, you could serve this with rice with some additional steamed vegetable.
Sure. The flatbread has become very popular, especially if you're trying to stay away from the calories. Now, don't forget here on the plate, the only thing we're missing is our fruit. Don't forget 1 fruit with every meal, and you should be having satisfaction.
Good. And you have your good fats from the avocado. And there you have different vitamins from the vegetables. So Maribel, we're going to try this after the break.
Yes.
Don't go away, and for more recipes, go to our website, www.gethealthwithdrcooper.tv or cooperwellnesscenter.com. Thank you, Maribel.
You're welcome, doctor.
Okay, guys, don't hesitate to try that burger patty. It's very delicious. And most importantly, you will not consume any saturated fat. And that is good for health. No cholesterol will be in that patty. I'm going to take some time to welcome some of my Facebook visitors here, some friends. I have Juliet, Denser Fraser, Joy Marshall, Curtis Brooks, Monica Gonzalez, Erlene Desir, and many others. I want to welcome you to our program today where we're discussing pancreatic cancer, a cancer that no one likes to have. Prognosis is very poor. The cancer is diagnosed usually in an advanced stage with a life expectancy for 5 years, very, very slim. And I'm here emphasizing factors that you could use to prevent cancer, including pancreatic cancer. We discuss avoiding processed meats, avoiding red meats, and consuming more fruits and vegetables. Now, vitamin A, vitamin C, vitamin E are anti-cancerous vitamins. A diet high in fiber will protect you also from cancer. Phytochemicals are important to prevent cancer. Let's look at fruits and vegetables. Fruits and vegetables, consuming 4 to 5 servings of fruits a day, 4 to 5 servings of vegetables a day will improve your health and decrease your risk for cancer. Now, almost all fresh fruits are rich in vitamin A, rich in antioxidant, rich in phytochemicals that are capable of neutralizing carcinogenic substances. You know, as I mentioned before, it is believed that patients who are plant-based solely, they're vegan, that vegan blood will retard or slow the growth of cancer cells. So then let's create a healthy environment in your body where cancer cell will not grow. Now there's certain fruits, citrus fruits, lemon, oranges, grapefruits. These are rich in vitamin C, in flavonoids, in lemonoids, in pectin. These are all cancer-fighting chemicals. Plums and apples, they're great for colon cancer. Pineapples will slow the growth of stomach cancer. Grapes contain certain substances that will also fight cancer. Now berries are rich in powerful antioxidant that will neutralize carcinogenic effect of free radicals. Guava, kiwi, these are high in vitamin C. And vitamin C, as I say, will improve your health and help you retard cancer. What about whole grains? You've heard about whole grains. What are whole grains? Whole grains are unprocessed grains. Wheat, barley, quinoa, brown rice, black rice, whole wheat bread. These are high in fiber, and the fiber will increase the transit of the food through the bowel and therefore decrease the exposure of the intestine to carcinogenic substances. That's one. Whole grains are high in phytates. Phytates are anti-cancerous substances. Wheat germs has antioxidant, which will protect the cell from degeneration and protect against cancer formation. Now vegetables, most vegetables are high in vitamin A, vitamin C, antioxidant, phytochemicals. Vegetables like beets and carrots, these are rich in beta carotenoid and vitamin A and other carotenoids and fiber. Tomatoes, sweet potato, eggplant, bell pepper, all these are rich in beta carotene and other carotenoids and vitamin C. These are potent antioxidants to fight cell death and fight cancer. And I'm sure you've heard about onions and garlics. These are rich in flavonoids and sulfurated essence. These will neutralize carcinogens and inhibit the growth of cancer cells. So what should you put on your plates today as we're talking? All of the fruits and vegetables that I mentioned. Now cruciferous vegetables, these are broccoli, cabbage, kale, cauliflower, radish. These are high in a chemical that is called sulfurated phytochemicals. These are anti-cancerous substance. Now what about legumes? That's peas and beans, lentils. These are regarded as the poor man's protein. These are rich in fiber and anti-cancerous phytochemicals that are called phytic acids and phytates. And these will help you fight cancers. Now if you listen, I've been saying the words phytic and phytate. You only find these chemicals, phytochemicals, in plants. What do you find mostly in meats? You find protein, you find iron, and fat. If you consume a diet, I was giving a lecture recently and there was a patient there or somebody in the audience that said, I don't like vegetables, I don't like fruits, I like to eat a lot of meat. That person is increasing her risk for many diseases, not only cardiovascular disease, not only diabetes, high cholesterol, but also cancer. Because in meats, you do not have phytochemicals. You don't have the vitamins that you need to help your body to fight cancer. So you don't have vitamin A, you don't have vitamin C, no vitamin E. These are very important chemicals that are necessary to fight cancer. So if you're listening to me, don't get tired when you're seeing on the news or when you're hearing others talking about plant-based nutrition. And I'm sure it's very difficult to change our lifestyle. I mean, someone probably who has been eating a certain way, have certain culture for years, now you're told that you need to change lifestyle. It might be difficult, but remember, you can do it step by step. When you have your plate, look what's on your plate. Make sure that plate is half filled with fruits and vegetables. Another quarter is filled with whole grains, and another quarter is filled with good protein. Let me see if I have any question here. All right. Somebody said cancer can be cured by taking MMS. I'm not sure what is MMS, but we know that in order to cure cancer, first, we need to prevent the cancer. 2, early detection. And if I were to go back to summarize what we've been discussing, pancreatic cancer is a cancer that usually has no clear signs and symptoms. Maybe some abdominal pain, maybe some vomiting, diarrhea, some weight loss or elevated blood sugar. And usually this cancer is diagnosed late. Now, I had a patient who came on earlier in the program, Mrs. Carnes. She came in predominantly, her symptom was predominantly diarrhea and some abdominal pain. And during the course of working up the diarrhea, we found that pancreatic cancer. The cancer was detected early. It was encapsulated. It was within the pancreas only. And therefore, we removed 80% of her pancreas, and that's 16 years ago, and she's still doing well. No cancer. So share this video. I mean, if you imagine that if with this information we could save one life, and as I mentioned before, that 1 in 65 people in America will be diagnosed with pancreatic cancer. If we can save that one person, then we'd call this program successful. So I'd like you to share the program. Tell your friends that every Sunday, 6 p.m. Central, the program is on. And we might discuss various topics, important topics. And remember that this program is here to empower you, to educate you, so that you can take charge of your health. Many doctors, we really don't have time to sit with the patient and go through step-by-step lifestyle changes. But this is a program where you can learn how you can change lifestyle. I have 3 books on the market. One is Get Healthy for Life. Get Healthy for Life, I outlined 9 secret pillars of health, important factors that if you practice these habits, then you can prevent, reverse, or cure diseases. In that same book, I have mentioned stories of my patients who have done just that. My second book is 14 Days to Amazing Health. That book has health facts, patients' testimonial, reasons for consuming certain nutrients. I have over 100 plant-based recipes. I also have an exercise program where I have the basic level, intermediate, and advanced. If you follow that program, you indeed will see a change in your life. The other day, someone called me. I gave a book to a friend, and she called and said, "Oh, I have been following your program. I've lost weight, and I feel good." I said, "Please go and put it on my page. put your testimonial there. If you want to be such a person with this fantastic lifestyle change, then get my book. You can go to my website, Cooper.com, drdonnacooper.com. My name is spelled with one N. My other book is a recipe book, incredibly delicious vegan, in which I have delicious recipe for you to follow. I also have included 28-day meal plan, shopping lists to make it easy for you. So if you want to change lifestyle, if you want to change your eating habit and you don't know how to do so, then you can get that book. And please tell your friends about these great resources, because as you learn to improve your health, you should also share the information with somebody else. Now remember, healthy nutrition must be combined with exercise. It is recommended that for you to see a change in your health, then you should exercise at least 30 minutes every day. And at this time, I'm going to be demonstrating to you a very simple exercise that you could do at home and to improve your health. Let's go to our exercise video. Active living is important for strong bones. So at this time, I'm going to take you over to Christopher and Rebecca with Living Active segment.
Thank you, Dr. Cooper. Good morning. This is Living Active. My name is Rebecca Huerta, and this is Christopher Hanna. We're going to go ahead and be showing you an at-home workout that you can do from the comfort of your own home, because we all know that maintaining a daily workout routine is crucial in maintaining a healthy lifestyle. So the first exercise we're going to do is we're going to get you warmed up. You're going to want to go ahead and jog in place for about 2 to 3 minutes. And once you have completed those minutes, you're going to go ahead and do some calf raises. You're going to raise up about 20 reps until you get those lower body nice and warm. And then we're going to go ahead and do 20 air squats. It's very important to get your whole body warm before doing a workout because you don't want to get hurt. And then we're going to go ahead and show you 3 exercises. The first exercise is going to be a kettlebell lunge with a twist. You're going to go ahead and hold the kettlebell with both arms. You're going to lunge and you're going to twist. But when you lunge, you want to make sure that your knee does not go past your toe, because that can cause an injury. And when you twist, you want to go ahead and engage your core. Make it really nice and tight when you twist. We're going to want to do about 3 sets of 30. And then we're going to move on to the next exercise, which is going to be a kettlebell front squat. Now you're going to go ahead and want to hold the kettlebell from this side and go ahead and squat down. And you're going to keep your toes pointed out just a little bit so you can go ahead and squat, and make sure again that your knee does not go past your toe. You're going to do 3 sets, about 20 to 30 reps for this exercise. And this next exercise that we're going to do is going to be a squat with a twist. You're going to want to go ahead and squat down, and you're going to bring your elbow to your knee. And you're going to do that with the other side as well. But also you want to make sure that you go down nice and slow, and you get up and you go ahead and twist. All these exercises are working out your lower body, but it is also engaging your core. So you're working out 2 muscles at the same time, which are the biggest muscles in your body, your core and your legs. And when you finish, you want to go ahead and make sure you stretch out any tightness you feel, drink plenty of water, make sure you take plenty of breaks that are needed throughout the workout. Now thank you. This is Living Active. Now back to Dr. Cooper in the studio.
Thank you so much. I want to thank Christopher and Rebecca for that beautiful workout. Now, listeners, do that this week and you'll feel a difference not only in your joints and your body, but if you're diabetic, sugars will go down. If you're hypertensive, your blood pressure would also go down. Let me take the time to welcome a few of my viewers. I have Rosalinda, welcome. Robert, welcome. Sonia Quiroz, I want to welcome you. Myra Salinas, welcome. Yvonne Alanis, Let's see, Morris Henry, Robert, welcome. I'd like you to share this video because I think the information that I have here is vital. It's vital to help you, your friends, or your family gain better health. You know, having the disease is one thing, but being able to prevent the disease or to obtain the information to make early diagnosis is very important. So pancreatic cancer, as I say, is a cancer that you do not want to have. The risk of death is very high, 93% within 5 years. The symptoms are very vague: abdominal pain, yellow discoloration of the eye, brown urine. You might just have weight loss, high blood sugar. If you have any of these symptoms, then you need to seek the help of a doctor. And remember that a healthy lifestyle is most important. Eating a plant-based nutrition will empower your body to fight diseases. Getting regular physical exercise is important. Meditation, have trust and faith in God is very important. Research have found that patients who have a faith-based community, patients that go to church once a week or twice a week, tend to outlive others by 10 years. So if you don't have a church, visit a community church. Find a friend with a church, ask questions, go somewhere, get your Bible. And if you were to purchase my book, 14 Days to Amazing Health, I have outlined 14-day principles of how to read the Bible, how to meditate, and how to obtain good health. Friends, God wants you to have good health. 3 John 2, he said, "Beloved, I wish above all that you may prosper and be in good health." So until then, remember to eat healthy, exercise, and meditate, and God will give you the strength to obtain good health. Share my video, like, and help someone to stay healthy. Until then, stay healthy.